Hey, Greg Spindler here. Let's talk about IT band syndrome or issues with their TFL, tensor fasciae lata. Everybody's different on how we need to treat that. If they come into your office and they've got a left hip coming forward and the right hip going backwards, if the complaint is IT band syndrome and issues with the TFL on this side, that's shortness. That's shortness. So it's easy to work with. But what if they got IT band syndrome on this side? This is locked long and pulling tension either up in the insertion or way down the insertion on the tibia and outside of the knee. So everybody's different on how we need to treat it. If they come in with a bilateral pattern with anterior hips on both sides going forward, which means flexion, an extension in the back, meaning a lordotic curve, then that would be treating the IT bands equally the same. Same with extension. If we got extension with the hips and flexion, more of a pogo stick back, flexion with the lumbar spine, we can treat that the same way as well on both sides. But if they're different, if they've got a torsion, that's different. If they have a side bend with a flare, that is treating the IT band differently. So you have to understand what's going on, the difference between the left and right, or if they're anterior or posterior with the hips. I'll talk to you soon. I'll see you in class. Please take our workshops, csbworkshops.com. Talk to you soon.